We'll take a moment while I'm introducing Dr. Donaldson, and he's getting a microphone switch going on here. Dr. Josh Donaldson obtained his doctorate from the National College of Naturopathic Medicine in Portland, Oregon in 2004. This is followed by a postdoctoral research fellowship as a clinical research nutritionist at the RAT Research Institute, and then a one-year private residency in pain management rehabilitation. Since then, he's been in private practice for 13 years and is the founder and medical director of the Longevity Medical Institute in Los Gatos, California, where he specializes in IV therapy, ozone therapy, and regenerative medicine for chronic disease, anti-aging, and pain. In addition, he has served as an adjunct professor at multiple community colleges and universities in the Bay Area since 2006. And has been a guest speaker on various topics of medical conferences throughout the United States. So please welcome Dr. Donaldson.
Thank you. All right, thank you for that introduction, and thank you, Emma, for a great talk. We got kind of wrangled into this at the last minute here by our colleague, Eric Zaremski, a dentist that Emma works with. And we didn't have a lot of time to kind of curtail our two talks together. So there's a lot of overlap. She had a lot of great information, some of which I'm going to be kind of overlapping and repeating a little bit, but I'll kind of move quickly through that for the sake of time because we're a little bit behind now. But anyway, I'm a naturopathic physician. I have a clinic down in Los Gatos, California. As he mentioned, I do pretty much general family health with a focus on regenerative medicine for chronic pain and orthopedics, as well as various chronic diseases. And over time, in the last 10 years, I've slowly developed close relationships with my local dentists in the area. Not only because I see the validity for its importance with creating an integrative model towards overall health and well-being, but I just kept seeing a repetitive pattern with some of my patients, specifically cancer patients, autoimmune patients, cardiovascular disease patients, where we ask them about their oral health and if they've had root canals or cavitations or, Mercury fillings, with a myriad of symptoms from, neurological stuff to chronic fatigue to, cardiovascular symptoms. And the connection was, beyond words. It was like almost every time there was, a major thing, whether it was cancer or whatever, it'd go back to like, oh yeah, I have, a few root canals here or a cavitation here. And so it just got me thinking, and so it's been a great growth period for me in, getting involved more intimately with the local biological dentists, of which I can give you a list for later in the South Bay, which is where I'm at. So anyway, we're going to talk about some of the things that Emma went over, but also I'm going to get more into mercury toxicity from amalgams, and a little bit on gingivitis and periodontal disease and cavitations and so forth. So we'll go ahead and get going here. Like Emma touched on, I really think it's important for all practitioners who are, hopefully open-minded enough to do that, but creating a good network with, between dentists and functional medical doctors or naturopath or osteopath to create this kind of new model in holistic integrative healthcare that's including the dental aspect of disease and dysfunction in the body. So anyway, we're going to go over and talk about some of the diseases associated, autoimmune disease, cancer, cardiovascular disease, mercury toxicity, and so forth, and various testing with mercury levels, routine blood work, and then a few other functional tests, and then various treatment approaches you can do from both diet and supplementation to things like ozone that's been discussed already, and various IV therapies to kind of support your system, especially going into root canal procedure and or cavitation surgery. Things like vitamin C and ozone, extremely beneficial before and after to boost the immune system and prep your body for a stronger outcome. Also addressing interference fields, or being able to clear and detox the body from certain things that are impeding you from healing properly. Okay, here's a quick review of tooth anatomy. You saw a few slides on this from Emma, but it's just real important to keep in mind, again, like she said, the tooth is a living structure, and I didn't really, acknowledge this in my medical training. It was after the fact, but as you can see here, it's got a neurovascular connection to it, and specifically, within the dentin, all these different tubules that go through there that feed into the bone, which is along with the neurovascular canals, is where infections become problematic. Tooth meridian chart. This is, unfortunately, it's too small of print for you guys to see, but kind of like in acupuncture, the homunculus on the ear and in the brain, there's different parts of the body, and in this case, the teeth, that relate to different organ systems, just like reflexology in the feet, if you guys are familiar with that. So it's not necessarily a direct diagnostic tool, but in some cases, it's a good screening tool, kind of like I do a little bit of iridology sometimes too. You can see, if someone's got their blood sugar is off, or they have cardiovascular disease in their family, you can look at certain things or ask about certain teeth that are associated with different organs to maybe figure out something deeper that's going on that's not quite on the surface in your history and physical. Again, here's a more elaborate view of the tooth organ relationship. You can find these online, just searching this, that exact phrase, and it's pretty interesting information out there on that. Okay, gingivitis and periodontal disease, again, a swelling or inflammation of the gums, classified by how it looks, its cause, and how long it lasts. There's different types. The predominant source here is plaque-induced. You can have both acute and chronic. And there's a progression of disease here. So early stage gingivitis starts as with gums red, swollen, and bleeding easily, progressing to periodontal pockets where plaque begins to form below the gum line, where gums are receding and pockets form. So this is when dentists go through when you get your checkup with a little tool at the gum, giving you certain numbers or rating on how much those gums are receding. That's what they're checking for. And then more advanced periodontal disease, we see chronic presence of plaque and tartar, where the bacteria is destroying the gum and the bony structure around the teeth. And this is a good kind of progression of the gum disease here. Healthy on the left, moving all the way through to advanced periodontitis on the right. Signs and symptoms, pretty straightforward. Puffy, discolored or bleeding gums, or even bad breath. That's another tell sign. If your spouse is telling you have bad breath, you might want to look into it and start brushing or flossing more. And again, do not ignore other symptoms that are coming up that are more systemic and not specifically just tooth or gum related. If you've got heart disease or diabetes, its origin might be coming from your teeth or gum health. Here's a depiction of the difference between healthy gums and kind of early to moderate gingivitis. List of risk factors here to keep in mind: poor oral hygiene, of course, older population, those who chew or smoke tobacco, genetic predisposition, stress, grinding your teeth, and then again other diseases such as heart disease, diabetes, RA, poor diet, and obesity. Conventional approach, regular dental cleanings, antibacterial mouthwash, retainers, and treatment of other health conditions. We're going to get into more of a naturopathic approach to prevent and reverse gingivitis. Specifically dietarily, you want to focus on healthier foods, maybe even do a anti-inflammatory diet, wild-caught fish, or anything that's strong or high in omega-3 fatty acids has been shown to give a lower incidence of periodontal disease. Fresh vegetable juices, and I even found xylitol, chewing gum with xylitol helps prevent plaque buildup in the mouth. And the pectin that's on certain fruits and vegetables, apples in particular, have a high amount of pectin. That's almost like if you can't brush your teeth in the middle of your day at work, you have an apple, and it's a good way to clean your teeth during the day. And then some pretty typical foods to avoid: sugar, empty refined carbohydrates, fruit juice, processed foods, grains, and hydrogenated oils like canola, soybean, etc. And a few options here on treating gingivitis. You can do a natural mouthwash with like a peppermint oil or tea tree oil, just a few drops mixed in a little bit of water. Swish and spit just like you would your normal or over-the-counter mouthwash. Again, brushing your teeth twice a day with soft bristles is very important. Flossing, and then Emma already talked about oil pulling. You want to be sure to spit it out, especially in the trash, not in your sink, so you don't clog your drain. But you don't want to swallow it after you've swished it in your mouth for 15 to 20 minutes. Some supplements in particular that are important. Does this work? Oh, it does work. Vitamins A, B, C, D, E, and K, as well as minerals, magnesium and calcium, zinc, have been shown to help prevent and reverse gingivitis. And then a few topical applications that you can do. Emma mentioned neem before, but there's also clove and turmeric you can do as well. I want to talk about a couple cases real quick here. Dr. Sawyer is a close friend and colleague of mine. He actually just retired. He was with Los Gatos Dental Group, I believe. He has a couple associates working under him now, Dr. Dirks and can't remember the other one. Anyway, we did kind of a clinical trial in our office with his patients that had, we're just like 3-4 blocks from each other, but we did kind of a clinical trial in our offices, testing people with advanced periodontal disease and doing high-dose ozone therapy intravenously. Emma talked about all the other applications and avenues you can do ozone therapy. I don't think she mentioned intravenously, but you can do what's called a major autohemotherapy. If anybody's heard about that, I know they've done a lot of talks on ozone therapy here at the Silicon Valley Health Institute. But what we found is if you can do high-dose ozone therapy, which is like a multi-pass of 200 cc's of your own blood, going in and out, getting ozonated up to 10 passes. So it ends up being about half your total blood volume in your body, about 2 to 2.5 liters that's getting ozonated. It is thought to stimulate pluripotent stem cell activity in the body. And over the course of just like 2 or 3 treatments with some of these patients, their gum health, they weren't really doing anything different, as far as flossing or brushing their teeth, more or less or anything like that. We were just trying to isolate it with the ozone therapy, and we were seeing this huge improvement in periodontal disease and gingivitis. He actually spoke on it at a conference last year, but anyway, it's really encouraging. We've thought about possibly publishing the effects or the outcome from that, but it's got some promising results in the field of dentistry. Preventing gingivitis, we talked about that. We'll go on to that. Okay, again, some of this is overlap. Importance of a successful root canal and or avoidance of one all together. There's a breakdown of, again, a normal tooth and what's happening with a root canal. Again, 2 options you have when you get to that point of having a hot tooth or an infection or abscess tooth. You either pull the tooth, or fill it with the plastic-like material, or there's probably less toxic options now, like you were talking about, which is still a root canal, but it's just a healthier approach to getting a root canal. Anyway, so dentists will figure out how to clean the tooth that's dead nerve tissue out and disinfect the inside of the tooth and fill it. However, if you go back to that initial tooth picture, the dentin within the tooth itself is made up of tubules. So those tubules are not getting cleaned like the rest of the tooth. So that's where bacteria gets trapped in those tubules and now sealed inside the tooth, which creates problems and can eventually lead to cavitations. So the bacteria are cut off from their own blood supply, which they like. They like a oxygen poor environment. It's like a little petri dish in there for them to grow. So they then multiply and then start releasing dangerous toxins. And research has found that even the most meticulously cleaned and done root canal procedures leak around the filling material, and those bacteria get out and go directly into that bloodstream at the bottom of the tooth, at the root. They also showed in DNA analysis that 400% more bacteria have been found in the blood surrounding the root canal tooth than were found in the tooth itself. This is where ozone therapy really comes in handy as well for injecting and trying to kill off the bacteria around the base of the tooth. Furthermore, the bone around the tooth has been found to even higher bacterial counts in the blood. This taxes your immune system that doesn't care for dead substances, and then just the presence of that dead tooth and dead tissue can cause your system to launch an attack. So how does this affect us? Infection plus the autoimmune rejection reaction are all reasons your body may be affected by the root canal tooth. These infections and reactions, seed infections and problems not only in the local bone, but also areas and organs far distant from the infected tooth. This is how other organ involvement comes to play from just a tiny little infection in your tooth. So here's some of the diseases associated with kind of the myriad of periodontal disease, infected or abscessed teeth, and root canals. It's pretty widespread. It's incredible to see what all can be involved just from a simple tooth infection. Cardiovascular disease, atherosclerosis, sinus issues, obesity and diabetes, arthritis, a bunch of different autoimmune diseases, Alzheimer's in particular, thyroid disease, premature births, and of course cancer, which we'll be getting into a little bit here, specifically breast and colon being the most predominant ones. Here's just a quick depiction of that whole progression of going from periodontal disease, you get an infection, or unhealthy gums. That's then leaking into the bloodstream, where you get a myriad of different health concerns going on throughout the body. Okay, specifically with cancer, there was this Dr. Robert Jones researched the relationship between root canals and breast cancer. Emma had some great slides on that with thermography in particular. But they found an extremely high correlation between root canals and breast cancer, specifically on the affected side. So if it's a back right molar, it's going to be a right breast cancer scenario. And over a course of 5 years, with 300 different breast cancer cases, this is a pretty long-term, widespread study. They found 93% of those women with breast cancer had root canals on the same side. Hard to ignore that. Okay, getting into cavitations now. We'll kind of cruise through this because a lot of it's overlap of what was already discussed, because I want to spend more time on the mercury toxicity. Yeah, platelet-rich fibrin technique. Are you guys doing that with your stem cells?
No.
No, you're just doing straight stem cells? You're
Stem
playing.
cells.
Okay.
From the lab powder, we just mix it with sterile water and we inject it. But this is the plan, the next step.
Okay. Yeah. Yeah, I think doing them together provides a more synergistic effect. I do PRP and stem cell injections orthopedically, and it allows for kind of a better mesh network to adhere to, like the cartilage or whatever tissue you're trying to inject it to. So anyway, this guy, Dr. Nunley, have you heard of Dr. Nunley, Emma, in Texas? He's a pretty well-renowned, kind of controversial character, but he has a strong following, and he seems to be on top of it as far as his knowledge with dentistry and an integrative approach. Anyway, so the platelet-rich fibrin is an interesting topic that was first started in France in 2004. Some people do it as a standalone treatment for cavitations, and now with the exposure now to biological medicine with exosomes and either allogenic or autologous stem cells, you can combine the two together. As I said before, a huge benefit is also integrating in IV vitamin C or even an oral high-dose vitamin C to bowel tolerance before and after your procedure to facilitate a more efficient healing and have your body respond better to the treatment, as well as major auto chemotherapy or high-dose ozone therapy. There's a picture of a cavitation there, and as I think you mentioned it briefly, this is like the gold standard in being able to identify cavitations. As far as I know, I'm not a dentist, of course, but with routine x-rays, you cannot see cavitations. Is that right? Yeah.
So if I can just comment.
Yeah.
Digital x-rays is two-dimensional picture of something that is three-dimensional. And this is a three-dimensional imaging, so we can see every single slice of every single
Yeah.
patient.
Yeah.
So this is the only way to find those.
Yeah. And do you guys do this in your office, or you have to send it out? Yeah. So anyway, if there is any of you or your family, friends have the threat of a potential cavitation from an abscessed tooth or whatever, highly recommend, seeking out your resources to find a place that will do the analysis and imaging with the cone beam CT. All right, getting on into Mercury. Am I to stop at 9-ish?
Yeah, probably a few minutes before to give us
For questions? Okay. All right. Mercury is kind of a hot topic now, especially with fish. If you're a walking, breathing human being, you hopefully know at least the mercury issues with fish, going from bottom feeders to some of the larger fish, and the varying degrees of mercury exposure there. Also, of course, broken thermometers. But with this lecture, we're going to focus mainly on mercury amalgam fillings. So there's two different types of mercury: elemental or inorganic, and also organic. This is mainly found in fish as methyl mercury, as well as amalgams, and in some vaccines as either methyl mercury or thimerosal, as much as the AMA and the FDA want to dispute that. I think there's plenty of evidence there that it is in there, as well as some other heavy metals like aluminum and lead. Anyway, excretion with organic mercury is about a third as long as inorganic mercury, and it primarily targets brain, liver, kidneys, placenta, fetus, which is a big thing, especially when considering if a mom who is carrying a child is already toxic with heavy metals, or she's got mercury in her mouth. The fetal brain tissue is like a sponge. So this is where you're kind of seeing a lot of incidents carrying over from heavy metal toxicity with mom, and not necessarily just mercury. But heavy metal toxicity from mom, it's going through her bloodstream and then on into fetal circulation, and then it's the fetal brain is like a sponge. So this is where I think, autism spectrum disorders and other developmental disorders can be initiated from. So I try to encourage anybody who's coming into my office who's wanting to start a family to do kind of preemptive, preventative work to try to, identify and address any heavy metal toxicity or burden, and doing chelation and other detox things. You're just going to set yourself up that much better and your children better for a healthy baby. All right. You can see here as elemental or inorganic mercury, all the different things that it targets. Again, the brain being the biggest one, easily passing through the blood-brain barrier, as well as a myriad of different organs involved, kind of similar to with gingivitis and periodontal disease and cavitations. It starts in the tooth, whether it's an infection or whether it's an exposure to mercury, and it can progress and go to other parts of the body and wreaking havoc there. So here's what we now have as the healthy option with composite fillings compared to the old school mercury amalgam fillings. Hopefully, we have kind of an older crowd here, so there's probably, how many people know they still have mercury amalgam fillings in their mouth? How many people used to have them but have gone to a biological or holistic dentist and gotten them out in a judicious way? Good. So all those others who raised their hands first, you now have Emma and Eric to go see up in the North Bay or other places down here along the peninsula. Okay, so mercury has a tremendous deleterious effect on the body in different ways, all the way from oxidation status and mitochondrial function, or dysfunction rather, to affecting the immune system, central nervous system, from having neurological agitation to anything from feeling crazy to headaches, to other neurological symptoms, ocular issues, cardiovascular issues, general, fatigue, endocrine, reproductive. We're going to get into these in a little bit here. I don't want to go into too much detail. A lot of this is kind of more technical, medical jargon, but the big point here is mercury can increase reactive oxygen species in the cell, which turns on and causes an increased activity of glutathione peroxidase, thioredoxin reductase, as well as antioxidant response genes. Anyway, higher doses of mercury absorbed into the body inhibit NRF2 from working, and NRF2 is an important factor for mitochondrial function. Immune system, you'll see by way of chronic modulation of the immune system, mercury may induce autoimmunity in the body. It shifts an immune system away from Th1 response to a Th2 response, which is your T helper cells, which is not the preferred method. Mercury can also cause mast cells to degranulate and release histamine, which is a major pathology of histamine intolerance. More and more people I'm finding clinically nowadays have histamine issues due to mast cell instability, and I think mercury might be an underlying cause of that. Again, central nervous system increases oxidative stress, which can increase neurodegenerative diseases, affecting neurotransmitter levels here, epinephrine, norepinephrine, and dopamine, dysregulating our cognitive function. And also there are studies that show that it induces amyloid plaque production as well as tau proteins, which are directly related to the incidence of Alzheimer's disease. I'm going to skip over that. Again, cardiovascular system, increased risk of atherosclerosis and cardiovascular disease by way of, for one way in particular, reducing nitric oxide, which is very important for cardiovascular health. It also has been shown to increase LDLs, oxidized LDLs in particular. From an endocrine standpoint, it's been shown with higher levels of mercury in the system, it may increase ACTH levels, adrenocorticotropin levels, which is in response to our cortisol levels. Mercury also builds up in the pituitary system and may inhibit the release of arginine vasopressin. It also blocks thyroid hormone production and inhibits pancreatic cells from releasing insulin, which is where the diabetes component comes in. Reproductive system, there's a growing number of evidence showing that it may cause subfertility or less than advantageous fertility, infertility, intrauterine growth retardation, spontaneous abortions, birth defects, etc. Also been linked to menstrual disorders and irregular cycles, painful periods. We'll hold the questions to the end if that's okay. Inhibiting the release of FSH and LH, as well as potentially being linked to erectile dysfunction. Fetal development, we kind of talked about that already. Again, this is coming back ultimately to mom, not to put pointing all the fingers at mom, but it is a huge issue if mom is already toxic with a heavy metal burden and has metal in her mouth. Highly advise getting that taken care of before trying to conceive. But you can see here on the right, study of 64 children exposed to mercury during development showed signs and symptoms of all these different neurological symptoms here in almost all the cases. It's like 77 up to 100%. Pretty significant there. Again, cancer, the main cancer effects, again, are breast cancer and colon cancer for the research that I found. Mercury's been classified as a human carcinogen by the International Agency for Research of Cancer and by the German MAC Commission. I forget what the MAK stands for, but it has to do with cancer research. It lowers natural killer cells, increases induced apoptosis of CD4 T cells, and has a few other effects there. Okay, so mercury testing. How do we figure out how much, if at all, mercury is burdening our bodies? There's three major ways to test for it: blood, hair, and urine. General routine blood testing by way of like LabCorp or Quest is probably the poorest, least accurate way to check for it. It's a snapshot in time. They're not really testing. It doesn't tell you whether it's like inorganic or organic mercury. Hair is okay, especially if you're trying to test young children who don't want to do a urine test, or it's too hard to collect their urine, or you can't do a challenge test. But under my training, I've been under the understanding that the urine provocative test is the gold standard. That's where we're actually provoking your system with the chelating agents, DMSA or DMPS for mercury and lead, and then also we do general heavy metal testing too with EDTA for lead, arsenic, cadmium, and all these other heavy metals. These are the three main labs. I have no affiliation with them or disclosures to announce, but Doctors Data and Genova Diagnostics are both a urine test. You can either do it provocative or non-provocative. Quicksilver Labs is one that I've more recently got exposed to. They do a non-provocative testing. The thought there is that in some cases provocative testing might induce a flare-up on the individual, especially if they're very sensitive, because you're potentially releasing mercury into the bloodstream. But the idea is you're trying to catch the mercury from coming out, because it gets stored in fat tissue and brain tissue and so forth. And so the chelating agents like EDTA and DMPS, DMSA, by nature or by definition, to chelate means to sequester from. So it's pulling it out of the tissues and getting into the bloodstream. And so the bloodstream is going through the kidneys, right, and then it's getting filtered and ending up in the urine. So that's why it's called a urine provocative test, and that's what I know to be is the most accurate way to get a baseline testing for your heavy metal levels. However, Quicksilver Lab does a, what do they call it? A try Mercury tests where they're doing blood, hair, and urine, non-provocative. I'm considering switching over to these guys because it looks like a more comprehensive way to do it that potentially won't trigger a reaction in people who might be sensitive to the chelating agents. Here's what sample tests look like. We have quicksilver on the left. It's hard to see, but what you're seeing here is methyl mercury and inorganic mercury here with blood. And then you also have urine and hair down below on the right. Where it's doctor's data, this is very similar to also Genova diagnostics. You just get a breakdown. This is a urine provocative test with, you can't see it here, but this is with DMPS and calcium EDTA. You get a breakdown of like 15, 17 different heavy metals there from aluminum all the way to uranium, and spits out your levels here on the right. The Huggins protocol, this goes back to more dental work where you want to make sure you're doing a judicious approach to removing the mercury amalgam. Like Emma was showing you, the dentist should be masked up. There should be a dam around the tooth and vacuums being used to limit any possible exposure of vapors or particles being removed and then readmitted into the patient. A couple things to keep in mind: if you do have metal in your mouth currently, it's important to not use things like glutathione or cilantro or chlorella because they can potentially pull out and redistribute the mercury throughout the body, which could obviously wreak some more havoc. So you want to make sure you get the mercury amalgams removed first before you start getting into using some of these other things like cilantro, chlorella, and glutathione. My time is winding down here. Real quick, there's two options. You can do oral DMSA or intravenous DMPS. We do both in our clinic. We also have them do alpha-lipoic acid. That's important to take. Where is it? Right here. We don't have them start alpha-lipoic acid until 3 months after their last mercury exposure. That would be exposure meaning a mercury amalgam removal. Andy Cutler is a doctor and researcher that kind of condemns intravenous chelation treatment. He thinks it's too strong for individuals to tolerate. I beg to differ with that. I mean, I'm sure there's cases where some people can't tolerate it, but we do a lot of intravenous chelation with both DMPS and EDTA, and 90 times out of 100 people do okay with it. So we've stuck with that. But if you're interested in that, or you know you have a sensitive individual that might benefit from this, it's something to consider as well. Some other things kind of from a naturopathic perspective, and I'll finish on this, to consider when you're dealing with any of these things: periodontal disease, cavitations, mercury toxicity, supporting your organs of elimination. Our skin is our largest one, so sweating is important by the use of sauna. Also making sure your digestion and urinary pathways are also optimized, avoiding certain fish. I have a little image there on the next slide. Decreasing your exposure, of course, removing the amalgams, avoiding certain, creams and lotions that can have hidden heavy metals involved in them. There's a list of your fish. You guys want to take a screenshot of that if you haven't seen this before. You can look this up online. Just type in mercury levels of fish. But I keep one in my wallet, and we have one in my office. If you're a big sushi fan like I am, you have to make your choices wisely and keep it limited to just here and there.
Take a couple of questions.
Yeah, this is, I'm pretty much down here. There's a list of supplements. I won't get into this. This is Western Price and Western Price Foundation studied indigenous cultures back in the day. And the group on the left, these are indigenous people who ate a non-refined carbohydrate diet, just eating food off the land, meats and vegetables and fruit. You see their teeth are perfect. They obviously don't have a orthodontist in the middle of Papua New Guinea or some of these places. And this is what happens when they're exposed to refined carbohydrates and sugars over time. You get dental caries and periodontal disease and misalignment of the teeth and narrowing of the jaw and so forth. So it's pretty remarkable there. Okay, I'll stop there. Thank you for your time. Please feel free to
Let me say, let's
answer any
take 2
questions.
questions, and then if you have more questions, you'll be around during the break. People can talk to you,
Yeah,
I would imagine. So yes, over here.
Yeah.
Can you send us the list of dentists, biologic dentists?
Yes. You know what?
Is it possible to get those slides too?
Absolutely. Yeah. Why don't I can make, what would probably be easiest is get an email list going. Get your email, and I can have my office manager mail you the list of holistic biological dentists in the South Bay and the Peninsula that we work with that you could connect with, and I can send you the slides as well. Yeah. Yeah.
I guess.
On IVDMSA, is that contraindicated for patients with sulfur allergy?
Yes, it's IV DMPS. DMSA is the oral.
Okay.
Yeah.
Yes.
You know, I haven't had any patients that needed that with a sulfa allergy, but I think there is a sulfur donor in that compound. Let me, if you give me info, I can look into that and get back to you on that. I'm not know for sure, but you could do, you know, other things like alpha lipoic acid orally. The whole Cutler protocol is very challenging because he's adamant about people doing it either with or without DMSA or DMPS like every 3 hours. And if you research some of the stuff online, it's like people are getting up at 1 and 4 in the morning to take their alpha lipoic acid in graduated incremental doses. It sounds like a fiasco. My sleep is too precious to do that, but for some people it works if they're super sensitive. Yeah.
Okay. All right, thank you.
Yes,
All right.
thank you.
So,